Hi, I'm Evan Pantazi. I'm here today in Tenerife, the Canary Islands, off the coast of Africa, or Morocco more specifically, here to do a 2-day seminar. What I'd like to talk to you today about is Atemi, and Atemi as in comparison to Kyusho. Atemi means concussive striking to the head and or body, and it's a long ago art that was developed in conjunction with the grappling arts, and it's very important, but there is a distinction. Okay, a lot of people think that the Atemi is striking to shock, and it is, and you can strike anywhere in the body in a generalized pattern and still shock the body to set up for the throw, the lock, the grapple, whatever you're going to accomplish or trying to accomplish. However, the Kyusho is a little bit more final in its result. You're looking to incapacitate the person, not just merely set up for a subsequent attack. Now you can, and you should always be ready to follow up if you've missed the target, the tool wasn't adequate, or something happened that the Kyusho strike that you attempted didn't work. In fact, you should always flow from Kyusho to Kyusho, whether it be in the grappling, the tuite, the throwing, whatever. You can always use Kyusho to facilitate and expedite that technique, and or most efficiently and most effectively to dysfunction the person and drop them, render them unconscious, or more serious ramifications. So the difference between Atemi is just more of a shocking to the body, a concussive shocking, whereas the Kyusho is going to be a more debilitating or dysfunctional aspect, and it was really originally designed to kill and to maim the opponents so you would win in battle. It wasn't meant for a sportive activity. Now, in modern times, we've taken that down a notch, and we've learned to work with more finesse and dysfunctioning the body as opposed to damaging it. In fact, again, I've said this on many different occasions, that we don't have any injuries in Kyusho so far, and knock on wood, we won't. It's because we practice safely and smartly, and we're actually very target-oriented and understand what the body's going to go through. So, say for example, you strike someone on the upper body or head or neck or whatever you're doing, and you know that the hip is going to release or the knees are going to release. Positioning yourself and the opponent, or striking the opponent where you know they can fall safely, is what we're after there. Sorry, we had a brief interruption. Some lady came out into the courtyard here and thought I was talking to her or calling her or whatever. But anyway, the Kyusho has been tailored down so that it's more applicable for modern laws, modern uses, expediency. We don't put full power into the attacks as they would on a battlefield to end the opponents, so they wouldn't have to deal with them again, or they wouldn't surface later on to have revenge. So again, the difference between Atemi and Kyusho is vast. Okay, we're not just haphazardly striking, we're not just striking to set up the person. The Kyusho is a strike to end the conflict. So keep that in mind as you're going through. I know sometimes it gets very confusing in the terminology. The terminology between Denmark and Kyusho is also confusing. Kyusho encompasses it all. It is blood work, it is nerve work, it's muscle, bone, tendon, joint work. So it's not limited. The Denmark was more oriented toward the blood sessions, or the blood vessels and organs, and you can ascertain that because you go back into the ancient scrolls, the books, and what they wrote about with the neurological and hypovolemic shocks. So there was a small interruption again, so I'm going to bid you adieu here, and hope you're doing well today. We'll be back with you tomorrow for another episode. Take care.